The Week on Green 960.
Here again, Sebastian Kunz.
Time now for our top story spotlight, following up on two stories we've brought you in recent weeks, the state budget and the related cutting of in-home healthcare worker funds. California Healthline is reporting that although lawmakers did manage to scale down the governor's proposed cuts to health services, social services, many such programs still could face deep reductions in funding in the pending budget deal that's supposedly being worked on by legislators and the governor. Officials say the state likely will limit enrollment for Healthy Families, California's children's health insurance program, but probably won't eliminate the program entirely. A budget deal also may include Schwarzenegger's proposed changes to the state's in-home supportive service program. The governor hopes to reduce fraud in the in-home healthcare worker system by requiring caregivers to undergo fingerprinting and background checks. That's according to the New York Times. But it was those patients, caregivers, and supporters that demonstrated outside the governor's office in San Francisco Thursday. Reverend Israel Alvaran was up first, saying the cuts to service are going to the wrong places and the wrong people.
We have needs. We're human beings. Healthcare, good education, the enjoyment of life, having a quality of life that's high enough for us to have a decent life, it is a right. And for those who are really having special interests, they're the ones who just want profit at the workplace. These are management. These are big business people. These are those who own these big healthcare facilities. Now, we're the ones with special interests. We're the ones who have needs, Mr. Governor. And so, I admonish you, and I call on you and your allies to do the right thing. It is your moral duty. And if you believe, if you're a person of faith, you would listen to us. You would listen to people here behind you who have needs. So I admonish you, we need a balanced budget because people's lives are on the balance here.
Michelle Rousey has been a home health care consumer for well over a decade. She's in a wheelchair and said the governor needed to reverse the slashed funding before it's too late.
My care provider cleans, cooks, does many of my household chores that I cannot do. She cleans, she helps me bathe, she cooks my food, she does my shopping, she does all kinds of things that I can no longer do for myself. The cuts that the governor and our legislators have agreed to or are about to agree to are wrong. I deserve to live independently and not be stuck or thrown back into an institution. And we all do. All consumers do.
Rousey added that with the potential layoffs and funding cuts, patients like her probably will have no choice but to find someplace else to live.
One after another, as they get cut, you'll see people like myself no longer in your communities, no longer being able to be out and participatory. Our wheelchairs won't be fixed, other things. And I like being part of my community. I like being out. I like being heard. And this should be a right.
Phyllis Milandra is one of the affected home health care workers who spent some time addressing the crowd outside the governor's San Francisco office Thursday.
They're being told that maybe they won't get the household support that they need because it's not, quote, medically vital to them. The only way that such a thing could be conceived of is if people are viewed as part of a, quote, special interest group. We are not a special interest group. We are human beings with human needs. And the people who I work for can live happy, productive lives to the best of their ability if they can stay in their own homes. If they are forced to go into nursing homes, they will lose their autonomy as productive citizens, and guess what? It will end up costing the taxpayers and government a lot more money than it's costing them now. Thank you.
Another patient in a wheelchair chose not to give her name as a way of representing those whose names aren't known.
I have myasthenia gravis and systemic lupus. Therefore, I need medical care, including dental. My eyes change all the time, so I need special medical care to keep my eyes so my vision can stay, or I will lose it. I cannot cook myself food. I have to have help getting dressed. I have to have help bathing. I live at home and I want to stay at home. I have adult children who are out there being productive citizens in this world because I'm here as their mother. And they want their mother to stay alive. My caregiver behind me must take care of his own needs on his paycheck. When his pay is cut, what can he do? You know, he's given up himself already to help me to stay alive. And he can't go out and take another job. And the jobs are so far and few. So his cuts have really hurt me in both ways, my family, myself, and my caregiver.
What do you say to the Republican people who say there's just not money and we need to keep cutting and we need to keep cutting? What do you say to those guys?
The first thing I say is I'm not a political person. I do not belong in any political affiliation. But you need to cut in other areas. There are areas like the pay of the political parties, the members there. Have your pay contribute. You had a governor who was willing to tax the top 1% of richest people of the state to pay for the things, the basic needs, and they pay more than that 1% that would have been taxed to have him expelled as governor, removed. That you need to go back to think about that. People with money can help those who don't have any.
What do you think Governor Schwarzenegger's future is?
Well, the future of all human beings, we all live until we die, right? As far as it's political, I do not want to stay on that because I'm not a political person. I do not belong to any affiliation.
Tell me your name.
My name is the Nameless.
And although Governor Schwarzenegger contends such health care cuts would save money down the road as well, Democrats have still questioned whether the spending reductions would actually be cost-effective. Of course, it remains to be seen when the budget gets passed exactly where the cuts will land.